Hey everyone, this is Paul from Ortho Eval. Today I want to talk about Coflex wrapping an ankle. First thing I'm going to say is that I am not an athletic trainer, okay? I don't do a lot of wrapping of ankles, but I do them for certain reasons, okay? So if somebody comes in and they have some swelling around the ankle, especially on that medial side, or it could be anywhere in the ankle, then I like to Coflex. And the reason I like to do that, number one, is it's easy to do. Okay, and if they do well with it, then we know we could get into like some sort of a compression stocking or some sort of a stabilizing brace that might help. So if someone comes in and they have, let's say, a posterior tibial tendonitis, they might have some swelling and inflammation around here, we can try to support that arch. Even if it's an Achilles tendon, we can support that arch. I actually like to do Coflex wrapping with people who have retrocalcaneal bursitis. They seem to do really well with this when there's some compression on that area. So what I like to do is I like to start with some pre-wrap first. Only reason I like to use the pre-wrap is because I've had this done to me without pre-wrap, and I've got some pretty hairy legs, and it's pretty uncomfortable. And so this just really makes it a lot easier. I usually put more than I probably need to, but again, I'm not an athletic trainer. Those folks do this 10 times better than I do. And when I start this particular wrap, when I want to support the medial arch and I want to take pressure off of those medial structures, I start here and then I come down and around and then I pull up in the arch a little bit. So I might just invert them a little bit. I come right around, grab a hold of that heel, back up here, and then I might go down and around again and get a little more support in that arch. And I typically have patients wear this for about 2 to 3 hours, okay? And if they like it, they can continue wearing this for the rest of the day. I may put a little bit more wrap than that, but just for video purposes today, I kind of cut it short. But I would still follow that same pattern where I take that medial arch and I pull it up and I kind of secure it. The nice thing with Coflex is that it has some elasticity to it. It gives constant compression, so it's really good at decreasing swelling. If the patient comes back and they say that their plantar fasciitis or their posterior tibial tendonitis or Achilles tendonitis feels better, then we know that they may do well in some sort of an orthotic. It may be a semi-custom orthotic, it may be a custom orthotic, but supporting the arch might be something you want to do, especially if they have good relief with just something as simple as Coflexing. So I like to use it to get rid of swelling. I like to support those tendons that are irritated or inflamed, and then I use it as a diagnostic tool, not just to treat these issues. So if you have any questions in regards to the Coflex wrapping and swelling, tendonitis of the ankle, anything like that, please feel free to leave those questions in the show notes. If you like today's video, be sure to give us a thumbs up and be sure to subscribe. Thanks.